Welcome back to our Diabtron channel, dear viewers. Today, we have an important and informative topic to discuss. What causes blindness in diabetic retinopathy? Diabetes is a prevalent and growing health concern worldwide, and one of its severe complications is diabetic retinopathy, which can lead to blindness if left untreated. So, let's dive deep into the science behind it. Before we understand the causes of blindness in diabetic retinopathy, let's quickly recap what diabetes is and how it affects the eyes. Diabetes is a chronic condition that affects how your body processes glucose or sugar. High blood sugar levels can damage the tiny blood vessels in various parts of the body, including the eyes. The eye has a highly delicate structure with an intricate network of blood vessels, especially in the retina, the light-sensitive tissue at the back of the eye. These blood vessels play a crucial role in maintaining good vision. Now, let's take a closer look at diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that primarily affects the retina. Over time, high blood sugar levels can damage the blood vessels in the retina, causing them to become weak, leaky, or even blocked. These damaged blood vessels disrupt the normal flow of blood and nutrients to the retina, leading to various stages of diabetic retinopathy. Diabetic retinopathy progresses through four main stages. Mild non-proliferative retinopathy. In this early stage, small blood vessels in the retina begin to weaken and leak. Moderate non-proliferative retinopathy. More significant damage occurs as blood vessels become blocked, leading to reduced blood flow to the retina. Severe non-proliferative retinopathy. At this stage, a significant number of blood vessels become blocked, depriving the retina of oxygen and nutrients. Proliferative retinopathy. This is the most advanced stage, where new, abnormal blood vessels start growing on the surface of the retina. These new vessels are fragile and prone to bleeding, causing severe vision problems. Now, let's address the crucial question. What causes blindness in diabetic retinopathy? Blindness occurs when the damage to the retina becomes irreversible and extensive. Here are some key factors that contribute to blindness in diabetic retinopathy. Macular edema. Macular edema is a medical condition characterized by the swelling or fluid buildup in the macula, which is the central part of the retina in the eye. The macula is responsible for providing sharp, detailed, and central vision, allowing you to see fine details and perform tasks like reading and recognizing faces. Macular edema typically occurs as a complication of various eye diseases and conditions, with diabetic retinopathy and age-related macular degeneration being two common causes. Here's a brief overview of these conditions and how macular edema can be associated with them. Diabetic retinopathy. In diabetic retinopathy, which affects individuals with diabetes, the blood vessels in the retina become damaged due to high blood sugar levels. When these blood vessels leak fluid into the macula, it can result in macular edema. This condition can cause blurriness and distortion of central vision. Age-related macular degeneration, AMD. AMD is a progressive eye disease that primarily affects older adults. In the wet form of AMD, abnormal blood vessels can develop beneath the macula and leak fluid, leading to macular edema. This can result in rapid and severe vision loss. Other causes. Macular edema can also occur due to other eye conditions, such as retinal vein occlusion, uveitis, and certain types of eye surgery or trauma. The symptoms of macular edema can include blurred or distorted central vision, difficulty reading, and problems recognizing faces or fine details. The severity of these symptoms can vary depending on the underlying cause and the extent of macular swelling. Treatment for macular edema often involves addressing the underlying condition causing the fluid buildup. Depending on the specific situation, treatments may include anti-VEGF injections. Medications known as anti-vascular endothelial growth factor, VEGF agents, can be injected into the eye to reduce abnormal blood vessel growth and fluid leakage. Laser therapy. Laser treatment may be used to seal leaking blood vessels or reduce swelling in the macula. Corticosteroid medications. These medications can help reduce inflammation and fluid accumulation in the macula. Surgery. In some cases, surgical procedures may be necessary to address macular edema. Early detection and prompt treatment are crucial in managing macular edema and preventing further vision loss. If you experience any changes in your central vision or have a condition that puts you at risk for macular edema, it's important to consult with an eye specialist for a thorough evaluation and appropriate management. Retinal detachment is a serious and sight-threatening medical emergency that occurs when the retina, a thin layer of tissue at the back of the eye responsible for vision, separates from its normal position along the inner wall of the eye. When the retina detaches, it can lead to partial or complete vision loss if not promptly treated. Retinal detachment typically occurs due to one of three main mechanisms: rhegmatogenous retinal detachment. This is the most common type of retinal detachment. It happens when there is a tear or hole in the retina that allows the vitreous, the gel-like substance that fills the eye, to seep through and accumulate between the retina and the underlying layers of the eye. This buildup of fluid separates the retina from the underlying tissue. Tractional retinal detachment. Tractional detachment occurs when scar tissue or other abnormal growths on the surface of the retina contract and pull the retina away from its normal position. This can be associated with conditions like diabetic retinopathy or proliferative vitreoretinopathy. Exudative, serous, retinal detachment. In this type of detachment, fluid accumulates beneath the retina without the presence of a retinal tear or hole. Exudative retinal detachment can result from conditions such as age-related macular degeneration, inflammatory eye diseases, or tumors. Symptoms of retinal detachment can include the sudden appearance of floaters, which are dark spots or specks that seem to float in your field of vision, flashes of light, or sudden flashes of brightness, a shadow or curtain-like obstruction that starts in the peripheral vision and slowly progresses toward the center of vision, blurry or distorted vision. Retinal detachment is a medical emergency that requires immediate attention from an eye specialist, ophthalmologist. Prompt treatment is essential to reattach the retina and restore vision. Treatment options may include surgery. Various surgical techniques, such as pneumatic retinopexy, scleral buckle, or vitrectomy, may be used to reattach the retina. The choice of procedure depends on the specific characteristics of the detachment. Laser or cryopexy. These treatments can be used to seal retinal tears or holes in certain cases. The success of treatment for retinal detachment often depends on how quickly it is diagnosed and treated. Delay in seeking medical attention can lead to more extensive detachment and a lower chance of restoring full vision. If you experience any of the symptoms associated with retinal detachment, especially sudden changes in vision, it's crucial to seek immediate medical care to prevent permanent vision loss. Regular eye exams and monitoring of eye health conditions can also help in the early detection of risk factors for retinal detachment. Vitus hemorrhage is a medical condition characterized by bleeding into the vitreous humor, the gel-like substance that fills the center of the eye between the lens and the retina. This condition can cause vision problems ranging from mild blurriness to severe visual impairment, depending on the extent and location of the bleeding within the vitreous. Vitus hemorrhage can occur due to various underlying causes, including diabetic retinopathy. One of the most common causes of vitreous hemorrhage is diabetic retinopathy. In this condition, the blood vessels in the retina become damaged due to high blood sugar levels in individuals with diabetes. The weakened blood vessels can leak blood into the vitreous, leading to hemorrhage. Retinal tears or detachment. Trauma or retinal tears can result in bleeding into the vitreous. If a retinal tear progresses to a detachment, it can cause more significant vitreous hemorrhage. Age-related macular degeneration, AMD. Abnormal blood vessel growth in the wet form of AMD can lead to bleeding within the vitreous, causing vision problems. Retinal vein occlusion, a blockage in the blood vessels that drain blood from the retina, known as retinal vein occlusion, can lead to blood vessel engorgement and subsequent vitreous hemorrhage. Eye injuries or trauma. Direct trauma to the eye, such as a blow to the eye or a penetrating injury, can cause bleeding into the vitreous. Symptoms of vitreous hemorrhage may include sudden onset of floaters, which are dark spots or specks that appear to float in your field of vision, blurred or distorted vision, flashes of light or sudden flashes of brightness, a decrease in visual acuity. Severity of symptoms can vary depending on the amount of bleeding and its location within the vitreous. Treatment of vitreous hemorrhage depends on the underlying cause and the extent of bleeding. In some cases, vitreous hemorrhage may resolve on its own over time, as the blood is gradually absorbed by the eye. Treatment options may include observation and monitoring for spontaneous resolution, surgical procedures such as vitrectomy, which involves removing the vitreous humor and replacing it with a clear saline solution, may be necessary to remove the blood and address the underlying issue. Neovascular glaucoma. Neovascular glaucoma is a severe and relatively rare form of glaucoma, a group of eye diseases characterized by increased intraocular pressure within the eye, that can lead to damage to the optic nerve and vision loss. What sets neovascular glaucoma apart from other forms of glaucoma is its association with the abnormal growth of new blood vessels in the eye. Neovascular glaucoma is typically caused by an underlying medical condition that leads to the growth of new, fragile blood vessels on the surface of the iris, the colored part of the eye, and in the drainage angle of the eye, where aqueous humor, the clear fluid that nourishes the eye, normally drains. These new blood vessels can block the normal drainage of fluid from the eye, leading to an increase in intraocular pressure. The most common underlying causes of neovascular glaucoma include diabetic retinopathy. In individuals with advanced diabetic retinopathy, which is a complication of diabetes, damaged blood vessels in the retina can release substances that promote the growth of new blood vessels in the iris and angle of the eye. Retinal vein occlusion, a blockage in the blood vessels that drain blood from the retina, known as retinal vein occlusion, can lead to reduced blood flow in the eye and the growth of new blood vessels. Carotid artery disease, conditions that affect the carotid arteries, such as atherosclerosis, narrowing of the arteries, or carotid artery stenosis, can reduce blood flow to the eye and contribute to neovascular glaucoma. Symptoms and signs of neovascular glaucoma can include severe eye pain, blurred vision, redness of the eye, halos around lights, elevated intraocular pressure, rapid vision loss. Neovascular glaucoma is a challenging condition to manage, and treatment typically involves addressing the underlying cause of the abnormal blood vessel growth while also managing intraocular pressure. Medications to reduce intraocular pressure, laser therapy to treat the new blood vessels, panretinal photocoagulation, surgery, such as a trabeculectomy or shunt implantation, to improve drainage of aqueous humor. While diabetic retinopathy can be a serious threat to vision, there's good news. Early detection and proper management can significantly reduce the risk of blindness. Regular eye exams. If you have diabetes, make sure to schedule annual eye exams with an eye specialist to catch any signs of retinopathy early. Blood sugar control. Maintaining stable blood sugar levels through medication, diet, and exercise is essential in preventing and managing diabetic retinopathy. Laser therapy. In some cases, laser therapy can be used to seal or shrink abnormal blood vessels and reduce the risk of vision loss. Intravitreal injections. Medications can be injected into the eye to help reduce swelling and abnormal blood vessel growth. In conclusion, diabetic retinopathy is a serious condition that can lead to blindness if not managed properly. However, with early detection, lifestyle changes, and appropriate medical interventions, the risk of blindness can be minimized. Thank you for joining us today on this informative journey through the causes of blindness in diabetic retinopathy. Please don't forget to like, subscribe, and share this video with anyone who might benefit from this information. Your support helps us continue to create content like this to raise awareness about critical health issues. Stay healthy, and we'll see you in the next video.